My name's Dr. William Lum. I'm one of the GPs here at Sedbergh Medical Practice. When I came in 2004, there were 3 small GP practices, independent practices in Sedbergh. So it was an issue. It was a situation that was far from ideal. The whole thing was just too small, outdated. Time to move on.
My name is Diane Armstrong and I am the Centre Manager for Kensington Neighbourhood Health Centre, and I'm the Operational Manager for the building. We've received so many positive comments from staff, even though we've only been open 7 weeks. You know, they love the building already, and it's the fact that, you know, they can expand on their clinical services. So again, they've got scope to increase in terms of what they can deliver.
My name is Mrs. Sue Lennox. I'm one of the senior dental nurses and I work at the City of Coventry Health Centre. This is good, central location. Everybody can access it. We did a patient survey not so very long ago and we got a 96% satisfaction rate about coming into this new building.
My name's Andy Beaumont. I'm a GP in the Priory Gate practice here in the City of Coventry Health Centre. I've been working locally for 23 years, so I'm very much a local sort of person, familiar with the area and the needs of people. We've been working on relocating for the best part of 20 years really, and come up with various ideas and options, not all of which were satisfactory or affordable. And you know, when this project came up, it seemed like the one to get involved with.
What we try to do is evolve with working with NHS Merseyside and the property services. They basically say to us what services they want to put into the centre, because again it's based on the health needs of the local community, and that's what's important. So it's making sure that we're delivering the right services in the right place and at the right time.
I think again the access to the building helps enormously. Once they've reached our department, of course, we have, as I say, the advantage of having various clinicians with perhaps more specialised skills all on site at the same time. It makes us one big team.
We have a mental health therapist working here. We have, say, the health visitor comes here and runs baby clinics and walking kiddie clinics. The midwife comes here and does her stuff. We have chiropody and podiatry and all those sorts of things. They come here. It's just made it so much easier. We know that when the district nurses come in, we know where they sit. We know we can have a quick chat with them. We know when the health visitor's coming. You see people much more. The building has been really designed so that we can see each other. It's designed to feel warm and welcoming. It's designed not to be a traditional health environment, because the last thing we want, you know, it's a health centre or it's a medical centre. We're supposed to be about health, not illness.
My name is Rosemary Marsden. I live in Sedbergh. I live quite near the medical centre. I think having local healthcare facilities is really important, and I liked the design of the building. It fitted in with the kind of Yorkshire Dales and Cumbria.
We generally site the centres in the middle of communities where they're convenient for the local population and people can walk to them as well. They've got to respond to the needs of the local community in terms of responding A to their setting and B to the needs of the health of the local population.
Well, we've had loads of new patients registered, like over 800. The books are getting really full now.
Well, I think one main benefit really is, especially for the older people, they come here to see the doctor, and if they have to go for a blood test, rather than go to a hospital, they can come directly down here and have it done at the same place.
Patients can go to the clinics and bring a letter immediately from the clinic up to the reception, and we can facilitate their prescriptions or changes in treatments virtually immediately.
It's the wow factor when people come in, they walk in, and it's, you know, again, it's an environment that they're not used to. They're used to going into a small waiting room, you know, with broken furniture, things like that. So to come into something which is so modern, you know, and just provides all these facilities, the way that it has been designed and the facade on the front, it's on an arterial route into the city. So again, a lot of people see this building on their way into work or visiting the city.
We selected a locally based main contractor. And we made and that locally based main contractor employs a number of directly employed tradespeople. And we were keen, and we made a commitment with that main contractor, that we would seek to employ as many locally based subcontractors and suppliers as possible. The overall cost of the construction cost of the building was 1.7 million. Of that, I think 1.5 million was spent on contractors' supplies within a 50-mile radius of Sedbergh. Coupled with the fact that we specified local materials as well wherever possible. So the slate on the roof is locally sourced. The stone that makes up the external walls is locally sourced. And going forward, we've continued wherever possible to use those same locally based subcontractors to do the maintenance on the building as well. So I think hopefully that, there's benefit to the community in having a new health centre, but there's also been some economic benefit in whilst we were doing the works on site as well.
My name is Joan Spencer and I'm co-chair of the Patients Representative Panel for the City of Coventry Health Centre. We involved the local art faculty in designing the wall coverings and so on. We spent a lot of time choosing the furniture, making sure it was right, and trying to create an encouraging and pleasant environment so people felt as happy as they can do if they are ill when they came into the building.
We do a meet and greet service, we do a befriending service, and we also give refreshments to the clients and to the staff. So it's a fantastic place to work. It's the best job I've ever had.